episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome everybody again to another episode of our show with another really fascinating guest to talk about a really fascinating theme that is definitely part of our theme here at the show in creating a unique and better tomorrow. As a little background to today's show, every year it is estimated somewhere around 800,000 babies around the world are born extremely preterm, that is defined as less than 28 weeks of age. These infants are usually transferred to air-based neonatal intensive care units involved in supporting their heart and lung development. But obviously the exposure to air at such a young age leads to a lot of complications. Lungs aren't fully developed. And then there's a lot of other protective issues that the womb normally supplies that just aren't there. The concept of an artificial uterus or an artificial womb, that is a device that ultimately will allow for extra-corporeal pregnancy by supporting the growth of a fetus outside of the body that an organism would normally carry to term. Actually, this concept goes back to the mid-1950s, but in recent years has picked up momentum with the maturation of certain technologies, including some here in the city of Philadelphia that have tried to be developed over the years. The company Juno Perinatal Healthcare is a fascinating Dutch neonatal healthcare startup, which ultimately has a mission of developing a novel alternative environment similar to a mother's womb where extremely premature babies could be transferred, where lungs could remain full of fluid, umbilical cords attached to artificial placenta to improve nutrient flow, organ development, and ultimately ease transition of these extremely preterm infants to newborn life. And Juno is a companion project to a really interesting interdisciplinary consortium known as the Perinatal Life Support Project, which is a consortium of 3 European universities coordinated by Eindhoven University of Technology to establish the first ex-vivo fetal maturation system for clinical use. They're endeavoring to bring together leading experts in obstetrics, neonatology, mathematical modeling, industrial design, ex-vivo organ support. Needless to say, there are a lot of disciplines that go into doing something like this. It is truly multidisciplinary. The consortium is led by Professor Frans van den Vosse and Professor and Dr. Guid at Eindhoven. And in 2020, Juno and Perinatal was spun off by engineers Jasmijn Kok and Kok to assure that the translation of this could be done. We are honored today to be joined by Jasmijn Kok, who is leading this initiative, but also is the founder of a company, Nanny Nina International, which is an online nanny service operating in 24 cities throughout the Netherlands, Norway, and Belgium. She has a degree in architectural engineering from Delft University. Jasmijn, welcome to our show today. This is a really exciting topic. I'm glad to have you.
Thank you. And may I say, compliments for the introduction. You've done it better than I could have myself.
Thanks. I want to make sure I got everything in order because I know this is a complex topic, but it is a fascinating one, and I'm really looking forward to talking with you. Typically, as we do, I love to start off as we do this show by really just handing you the floor for a little bit to be, before we get into artificial womb technology and discussion, let's talk about you because you have yourself a fascinating background. Talk for a few minutes about who you are, how you got interested in architectural engineering in your current company, Nanny Nina, and how you ultimately got interested in this startup company, Juno Perinatal Healthcare.
Of course. So actually, I was born together with my sister, Laila, who is also involved with me in this project and is also my partner in crime with our company, Nanny Nina. So we grew up together in a small town in Delft, and our parents were also engineers and allowed us to actually draw on the walls when we were children. So we grew up in a quite creative environment, and they also had their own company. So we were brought up with creativity and entrepreneurship to begin with. My mother's an architect, my father's an industrial engineer, and my sister and I followed a bit in their footsteps. So that's how I started my career. But after working as an architect for 5 years, the company that we were running next to our careers, it just became bigger and bigger, more successful, and we couldn't do everything anymore. So we decided to choose and to start running our company full time. We also participated in something, it's called Dragon's Den. I think your name is Shark Tank or something in Philadelphia. And that's when it really took off, and we got to expand the company, and it grew international as well. So yeah, that's something we really like, to grow companies, to start new projects, and to start complex, almost impossible projects, which is also why we are now involved in our artificial womb project, because that is one big ambitious moonshot project. That, as you mentioned, it needs a lot of expertise from different areas, and it needs people to work together. And that is what I like very much about it. I actually got involved in the project because I contacted the lead professor, Frans van der Vosse, and wrote him if I could start a PhD with his research, because the topic just fascinates me, right? It's such a big innovation in healthcare that we are trying to achieve. I wanted to be part of it. But he looked at my resume, saw that we had some experience as entrepreneurs, and that's how he actually got us involved in the spin-off. Yeah.
Excellent. And I sit here in the city of Philadelphia on the United States East Coast, and interestingly, we have there's been some initiatives actually down the street here at Children's Hospital Philadelphia. They created something several years ago called a bio bag, where they played around with, I think, premature lambs and sort of experimenting with one angle of this. There was also down the street at another university, they tried for several years to create total liquid breathing technologies. That didn't go too far, but needless to say, these are cutting edge types of things. Talk a little bit about, because, in reading about the companion project, so that basically this consortium, 3 universities, many different pieces, talk to us a little bit about how that all started, because it clearly seems that to do this right, it needs to start off, it can't be a couple labs here and there playing with pieces of it. You really, to do this right in the long term, have to bring the pieces together. Talk a little bit about what the Perinatal Life Support Project is all about, how that got financed, a little bit of the background, how long that part of it has been in motion, to give some folks here in the US a little perspective on that.
Of course. Well, to start with a comment, the research done in Philadelphia is a big inspiration to us and all other researchers and engineers working in the field. So it's really brought attention and got the research rolling. So we're really thankful for that as well. The project started, or the idea started, quite a while back, already about 30 years ago, when the gynecologist of our project, Guid, he was still in training, and he was part of a congress where he saw a little goat in a bio bag or underwater. And this was actually even before Philadelphia did the sheep experiment, and that inspired him so much that during his work, when he saw the extremely preterm born dying on his watch, he wanted to really improve the healthcare. Because if you look at the data, like the past 10 years, not much has changed or increased. So if we really want to change and increase our healthcare, then we must do something that is quite innovative and breakthrough. Yep. So this is what has inspired him. And throughout his career, he became more and more interested and built a network to actually start this project. It really kickstarted in 2019 when we were awarded the Horizon 2020 European Commission fund of 3 million euros. Well, 3 million, that's where we can start working with. So in order to get that subsidy, we started to work together with our partners the Politecnico in Milan, in Italy, and of course our valued partner in Aachen in Germany.
Okay.
And we have divided the work such that their expertises of the different partners can be used to the fullest. So the Italian partner, they are responsible for sensors and measurements of the perinate, we call it, the infant in our artificial womb. And in Aachen, they are actually already building our prototype and working on the artificial placenta. With us, we also take care of, for example, the design, because a big part will also be the bonding between the parents and the baby. But that's a problem for now, a luxury to be able to think about that, because right now we are in the beginning phase of our research still, where we just have to make the technology work.
Mm-hmm. And, obviously a big thing, and, you mentioned some of this on the website, is clearly breathing. Oxygen is life. And I remember from, researching on my own the issues of liquid breathing, and how it supports the lungs, and the really unique nature of amniotic fluid and all that. So that's one major part. Clearly, the umbilical and nutrition and blood flow and all. What are some of the other areas that we might not think about? I mean, the womb does so much. It is a miracle that life happens at all. But what are some of the other parts of this? I mean, you mentioned some of the sort of the bonding issues and the psycho development. Other issues that you think about as you think of all the different pieces that need to come together for something like this to transpire.
Yeah, well, the most challenging part is actually going to be that we cannot make mistakes. So I can give a bit more, inside information on your question later on. But first I want to emphasize that it's not our goal to have the first baby in the womb, because it doesn't work this way. If you have it's like shooting a rocket to the moon, right? You can't get it wrong. It has to be right the first time.
Absolutely.
Because it's so important. So what we are actually specialized in the University of Eindhoven, is to create a 3D printed mannequin, a baby, that's based on MRI images.
Okay.
And that baby is connected to our decision support system. We call it the digital twin. And it's like an artificial intelligence, or it learns from the decisions that doctors make in order to support them also to make decisions. But we can also use the 3D printed mannequin, the baby, to help train the medical personnel. Because if we succeed, when we succeed to make this prototype, then what use is it if doctors cannot use it? And I believe that there are so many groups around the world already working on this. There are several groups that are trying to make this, for example, artificial placenta. But every group has their own expertise. So I'm a big advocate to try to make us cooperate and work together, because, for example, where we are really good in the training part and the decision support system, and that's where we have something to add, perhaps in Philadelphia, they're already a bit further with, for example, the prototype. And it would be amazing if we could actually start working together, because the goal is not to just create the first prototype, but it's to improve healthcare. And I believe we share that. So I hope that perhaps somebody listens to this as well, and they find out, and perhaps we can connect in this way.
Absolutely.
So to answer your initial question, one big problem or point for us right now is actually connecting the umbilical cord to the artificial placenta. And I know some of the other research groups have found a good solution for that. We are also investigating how to do that best, but this is one of the trickiest things we are working on right now. But there are many other problems, and I'm pretty sure we're going to run in somewhere while we progress in our research.
Yeah, I mean, that's when you're doing moonshots like that happens, but it's inspiring that you're attempting it. Along those lines, obviously, and so for the listeners and the viewers, I just want to sort of throw this one out there. We could discuss this. Artificial womb technology sometimes gets, I say, inappropriately conflated with this concept of ectogenesis, which is more or less refers to the full development of a fetus from scratch. There was, and obviously there are laws against that nowadays on how far you can grow an embryo sort of in a lab. That's not this. I understand that you're not, this is not Brave New World, but at the same time, do you get a lot of sort of from the public perspective thinking that's what you're attempting with this run, and any pushback from I mean, I know you got, not only do you have to get the technology right, but you got to get it right in the press and in the public domain to understand that, hey, you're not growing babies from scratch and all that stuff. Talk a little bit about that side of it, if you would, and some of the things you run into.
You are right. I think every journalist that we speak to, and a lot of questions that we get in our mailbox are about ectogenesis. So actually, we try to avoid that conversation. So what we are trying to do is to make the new NICU. Do you have this word as well? Yeah. So 2.0, like an improved version of that. But still, in order to have this work, we need to comply with the current law and regulations.
Sure.
Whether it's possible or not with the new technology, that is not the question that we focus on. We focus on developing a medical device that can improve the healthcare within current regulations and rules. So yeah, maybe it will be possible to have an infant of 18 weeks to go into our artificial womb. Perhaps it will be possible to leave it in for 50 and increase, I don't know what type of possibilities, but that's not what we're going to do and what we're working on right now.
Absolutely. I just wanted to lay that out there because I read a lot about that. I'm like, no, this is not the same thing. And so I think that was important just to get that one out of the way. Talk about the company. So you and your sister, you're entrepreneurs, you're business partners in this. Are you raising more private financing for the company? Are you hiring people right now? What's happening specifically with Juno, separate from the consortium, and how are you planning on building up the startup?
Yeah, so first of all, it's not just my sister and I working on this.
Okay.
There are more people together involved, and right now we are really under the wing of the PLS project.
Excellent.
We're working together with all the partners, but the importance is why we already now start in this early stage of the research is that we can in this way ensure that the research that we do gets to market. So parallel to the scientists, because my sister and I were both entrepreneurs and engineers, but we're not scientists, but we conduct market research and we do user interviews, we talk to the press, and we try to really get the market ready. And also, of course, the doctors, the medicine part of it, to accept our product and to have it producible when we're ready. So right now we are also funded by this European subsidy. We are part of the research project. And when we start to produce, then we will need to get extra funding, of course. So the timeline right now is that we will develop the prototype until 2024. We should have a prototype ready by then. And after that, of course, the process of certification, trials, clinical trials, it starts. And we hope, but it's hard to say because we can't predict the future, but by 2030 to have our medical devices ready to be used by patients.
Very exciting. Very exciting. It's once again, I love hearing stories like this and seeing what was just a few decades ago science fiction becoming reality. And you say you're not a scientist, but you are an engineer, and engineering is such a crucial part of this in terms of translating it, because the science is wonderful, but at the end of the day, it's the folks like you that think, well, we got to make something a certain size and flow and so forth and so on. So it's really fascinating. Any other specific topics around either the consortium or the company that I've missed that you might want to mention? Because this is all new to me as well. So if I missed anything that you want to talk about, please take the floor.
Yeah, what I also think is quite interesting point of view is that of the pricing and the payment, because if you look at how healthcare is financed, and I'm not from that branch, so for me it was an eye opener. Like, okay, so that's how it works.
Yeah.
is that the insurance companies are very important. And it's in the end not the patient or the user that pays for the care, but it's the insurance companies. So they're a very important stakeholder. And in this case, it's in order to get this funded and to make the business case possible, you need to include them. So there are after, even if you get the technology to work and get all the certifications right, it could still be impossible to use it because of some lack of business skills or lack of contacts and network in the medical world. So how does one make sure that the health insurance companies realize that this is important? And I think that this is also, next to getting the world to accept the product, this is also an important part to focus on.
Absolutely. Absolutely, especially especially on this side of the Atlantic Ocean, where we have slightly different healthcare funding structures. But yeah, really fascinating work, and really looking forward to see you and the consortium move this research forward. But very exciting. For everybody that is going to be listening to this particular episode or watching on a YouTube channel, you've been listening to Jasmijn Kok from Juno Perinatal Healthcare, the companion project to the Perinatal Life Support Project in Europe, doing some amazing moonshot work on the artificial womb front. 800,000 babies every year born preterm worldwide. There's a major unmet need there, and Jasmijn, I think you're definitely on the right path, and I'm just so glad to see that somebody is finally bringing this interdisciplinary group of possibilities together. So my hat is off to you. I want to thank you for taking the time to come on the show and introduce us to everything that's happening in the Netherlands with this, and thank you for what you're doing. And as we say, thank you for creating a better tomorrow, obviously for the 800,000 preterm infants. It was really a great time talking to you.
Thank you very much.